Good morning and good afternoon to everybody who's on the line with us. I'm watching as folks are still joining, which is okay for those that are a couple of minutes behind or for those who need to jump out a couple of minutes early. We completely understand. We will be recording this entire session and we'll make sure that we have a copy of it available for you a little bit later on today. For those of you that have been with us for the last couple of weeks, I think you know this, but for those who are with us for the first time today, it is so incredible to see so many different schools from so many different parts of the country with us. Over the last couple of weeks, the bulk of our participants have been from California, New York, the DC, Maryland, and Virginia area, and interestingly, a big swath from Texas as well. But each week we have more and more folks from different parts of the country who are finding their way to this call and joining us to have this conversation. And so for each of you, whether it's morning or afternoon, I am so grateful that you're spending this time with us and so excited to jump into today's conversation. For those that don't recognize my voice, my name is Chris Joffe. I'm the founder and CEO of Joffe Emergency Services, and I'll be leading us through this conversation today. But truly, as is always the case in a dialogue that we are putting together, this really is a conversation. And so I want to invite you to throw questions in, ask questions now, drop them into the question panel on the right-hand side of your screen. We will do our very best to get to every single question that is asked during our time together today. And we've done pretty well. We've had to go over time quite a bit. And so I want to just offer that we will prioritize those questions that we've seen most and make sure that we answer those before 10 o'clock Pacific or 1 o'clock Eastern. And for anybody who still has questions after that, or for really specific or individual questions, we'll keep going just about as long as it takes to make sure that we can get to every single one. So want to offer that if you have a question that is unique to your school or your community, we might answer it after 10 o'clock, but indeed we will answer it. And for those that can stick around and join us, you're of course welcome to do so. Let's see if our slides work. There we go. I also wanted to start with a little bit of housekeeping this week, and so offer a couple of thoughts. The first is, again, for those of you that have been with us for the last, whatever it's been, 5 weeks maybe, you know that we're sending out a weekly email on Thursday or Friday with updates from that week and some of the things that you should be thinking about for the week to come. We're also starting to include some of the hot topics that we'll address during the Monday call. So trying to give you a little bit of a leg up as to what we might be covering the following week. Of course, we're holding this call on Monday mornings at 9 a.m. Pacific, and we'll use these calls to give you both an update from the weekend where there has been one, and then to really dig in on those top questions. We are finding that Saturdays, we're getting anywhere between 60 and 160 questions from different schools around the country. And so we're trying to kind of synthesize those and really figure out what are the most common and where some of those are coming from. And then we're using this conversation to dig into those, especially those that aren't so black and white. And so indeed, we'll do just that today. And then I also want to invite those of you that have a Twitter or wish to make a Twitter to follow me on Twitter for updates throughout the week. Different weeks, of course, have varying levels of information to be shared. And so any given week, you may see quite a few tweets, you may not see quite as many, but this is a really good way to stay in the loop and make sure that you can ask questions throughout the week. And of course, for those who don't have a Twitter or wish to not ask on Twitter, you're more than welcome to email us to support@joffeeemergencyservices.com. And just as a general framework, our commitment to you is if you ask a question by Sunday, we'll answer it either by email or on this call by Monday. If you ask a question by Wednesday, we will answer it in our email on Thursday or one-on-one. So the last thing I'll say is that a few of you have asked where you can get updates other than Twitter throughout the week. And so I want to just call out that this top section here is not just overwhelming, but it's our website. And so if you go to joffeeemergencyservices.com, we have a coronavirus item on our navigation menu, and you can now click through the number of pages that we've created geared specifically towards coronavirus. And so I would offer that you are more than welcome to go there. You can see some of the most common questions on the FAQ section. Our updates page basically has all of the emails that we send out, and then there are additional pages below that as well. So that's how to stay informed. It's how to stay engaged throughout the week. And again, I would invite each and every one of you to do so. You're welcome to share this with any audience that would be helpful to you. And that brings us to our sort of jumping off place. As we've talked about over the last few weeks, I think there's so much news and there's so much information and there's so much stuff that is just flowing into our phones, our email inboxes. It seems that there's just so much new information that's coming out. And one of the big pushes that I have for each of you is to try to find a way to sort of step away from that when and where you can. And so we'll talk a little bit more today about self-care, but even more than that, just on a really day-to-day and minute-to-minute level, I want to encourage you to, when you're feeling overwhelmed, as all of us inevitably will at some point, take a deep breath, lean into whatever it is, or maybe even step away from whatever it is that might be there near you, and see if you can find a way to sort of give yourself the space that you need so that you can continue to be the leader that your community needs you to be. And so to model that, and also just to give everybody a fresh start to this week, I'll ask everyone on the call to take a slow, deep breath with us. All right, I know I can't see you, but I hope that you join me in doing so. And if you didn't, of course, you're more than welcome to now or anytime throughout our conversation today. We'll jump from there into what's in store for this week. And I would offer, as we've done in the last several weeks, that we're trying to sort of anticipate what challenges you might be facing this week, what concerns you might be facing this week. And I think, although we have a whole bunch of different pieces on the screen, I think probably our biggest challenge this week is the fact that people are getting increasingly more exhausted by the situation that we're in collectively. And by and large, the symptoms of that, or the way that displays itself in community interactions, is probably getting more and more challenging, not just because people's own sort of approach to managing that exhaustion is difficult, but because you're human too. And because as a human, you're subject to being exhausted too, and you're subject to being, to having operated in a situation and sort of paradigm that's different than you're accustomed to as well. And so I think it is only natural to find yourself running low on patience, running low on energy, running low on resilience, maybe even as we head into this week. And I want to, if nothing else, acknowledge that is true for so many of us. And so if that's the case for you, you're not alone. There are certainly others who are there with you. In fact, maybe it's all of us that are on this call are there with you. And perhaps the best thing that we can do is find that time and space to take a slow, deep breath. The other thing I want to offer this week is sort of built into that thought is this idea that for most of us, either as leaders in our community or as the safety person in our community or as the person that's sort of the go-to individual, whatever title may be associated with that or responsibility may be associated with that, maybe uniform might be associated with that, whatever it is that you own, there's also another piece of that responsibility or another challenge that goes along with it. And that is that you, especially as we head forward through these next few weeks, have to make sure that you're prioritizing self-care and prioritizing not just that slow, deep breath, but also a moment away, a moment of space, a moment of reading a book, as crazy as that may sound. And there are really some important reasons behind that. The first is that so many of us that are responsible for this are dealing with it pretty close to 24/7, right? And so although we may have worked to develop a sustainable system or a sustainable model where we could tag team somebody else in when and where we needed it, we're probably still feeling that responsibility day in and day out. And for those of us who have managed to sort of build that system and it's starting to work, we're probably still managing that responsibility 24/7. And so what I would offer is that it is so critically important that you not just empower somebody else to be able to be a leader within your community, but you also give them some time and some space to practice that. We are now starting to see leaders that are close to or are hitting that burnout moment. And so it's important to make sure that you do what you need to do to sort of push that out or maybe even avoid it altogether by taking the time for self-care that you need, by spending the time you need with your family, by getting away from your family if that's what's necessary, whatever it might be that helps you restore and re-energize and come back together. And so I know it's something that you're hearing a lot, and I know it's something that we certainly have been saying a lot, but I want to be as insistent on it as you'll allow me to be, because I think it is really the best way for us to make sure that we can continue to lead through this situation and that we can come back as the strong community that we need to be, whether it's in a few weeks, a few months, or really whenever it might be. So with all of that in mind, I think a couple other pieces I want to call out are, this idea that we can reasonably forecast 2 to 3 weeks out, and people want answers about 6 weeks out. And I'll tell you, again, for those of you that have been on these calls with us for the last few weeks, I've been kicking and screaming that we're just going to stay to this 2-week time frame. And today we're going to start to kind of open the curtains a little bit. We're going to look past that 2 to 3 week horizon. And I want to be so transparent with you to say, we have no idea what this is going to look like. We just don't know. We don't have the data yet. We don't have the historical perspective to compare it to yet. So as we do this, we're going to be looking with really imperfect vision at what the world might look like 4 to 6 to 8 weeks out. And what I want to challenge you to do, well, better yet, the reason we're going to do that is because for so many of you, the lack of planning or the lack of capacity to kind of look out and look ahead is simply overwhelming. And so I want to sort of lean into that and acknowledge that and do what we can to support that. But I also want to be really clear that it is imperfect data, it's imperfect vision. It's sort of like we're looking out without our glasses on right now, maybe even not quite that clear. And so I want to be clear about that up front. And I also want to encourage you that if you are starting to think ahead or talk ahead with your teams, that you offer that same sort of disclaimer, because I think anything less than that runs the risk of people getting too attached or too connected to whatever scenarios you might choose to discuss. The last piece I want to offer is over the last maybe 2 weeks, we've talked a little bit about graduation and end of year milestones and some of the things that we're starting to approach. And as we've done that, one of the solutions that we talked about was for students to actually be a part of the planning process. And we talked about it up front as sort of a fun way to get students engaged and maybe a way to get some different ideas. One of our schools said, let's do a design thinking exercise where our students actually redesign and re-envision and reimagine what graduation will look like. What surprised me was how incredibly innovative those students were as they took on this challenge. And we're now hearing stories of students who have designed, what is a probably new and improved and maybe here to stay version of graduation or version of end of year moving up ceremonies, and they've been incredible. And so I want to just acknowledge that and also sort of challenge us to think a little bit more, a little bit bigger about what our students might be able to at least be thought partners on, if not complete innovators on. And so I'll share some of those ideas either in our email later today or on Thursday. We're still waiting for permission from those schools. And because students are involved, it's a little bit more complicated to think about how we share those ideas out. We will share them as soon as we can. But in the meantime, I want to challenge you that you might be able to find some of those ideas from your own students too. So as we've talked about in the last couple of weeks, and as a reminder for those who haven't been with us, or as a heads up, maybe even for those who haven't been with us before, we're trying to use this paradigm, this now, next, later, and we borrowed it from the California Association of Independent Schools. And really the goal of it is to break things down. I heard one parent say, there's yesterday, today, and tomorrow, and anything outside of that, I just can't think about. This is sort of similar to that, but more adapted to the leadership perspective that so many of you take on. And so, what are the things that just must be done now? And I think I'm grateful for the fact that that list is actually starting to shrink. We've gotten the digital education set up, we've gotten students engaged, we've gotten food distributed, we've managed strategies to figure out how to collect funds and how to pay funds. We've we've done all of the, not all, we've done much of the critical now related work. And so as a community, we can sort of lean forward into this next concept. And so we're going to talk about that a little bit today with some reminders of now. And then, like I said, we're really going to, for the first time on these calls, start to peel back the onion a little bit and start to think about what later might look like. And so that's really our game plan for today. A couple of quick reminders for the now. We're still socially distancing. We're still virtually educating. We're still sort of leading with this like comfortably uncomfortable perspective. We listed here, if you're not already there, if you're not already comfortably uncomfortable, then now would be a good time to get there. And for many of us, we're talking about this idea of staggered staffing, or starting to think about how we can really set our communities up to be as resilient as we possibly can. And so for some communities, that's meant that there's an A team and a B team, or a red team and a green team, and those teams come to school on different days. And I should offer the caveat here, those are just our critical staff, just the people who we cannot function unless they're on campus. So that might be facilities, it might be a few folks from the business office, it might be security, it might be the tech team, but it's really a limited number of people who are on campus. And so we've broken them up into 2 or 3 or even 4 in some cases, and then set each of those individual teams, so team 1 through 4 as an example, up so that they're each operating on campus on a different day or on a different week or in some sort of unique pattern. And the story behind that, or the why behind that, is to make sure that should one person from that group test positive, that we may have to isolate that entire group or quarantine that entire group, but that we can actually still have those other 2 or 3 or 4 groups come to school. So that's one strategy that we've talked about, and that's one strategy that seems to be working for those of you who have started to adapt or adopt it, really. Of course, because we have it, for those of us that do still have people coming to campus, because there are people coming to campus, we have to stay really, really focused on our social distancing and on our keeping them safe. And so, one of the sort of controversial, maybe is too strong of a word, but challenging issues is this idea of whether or not we should be wearing masks. By and large around the country, the recommendation has shifted to, yes, we should be wearing masks. And specifically, we should be wearing non-medical, non-N95 masks, unless we're, of course, medical staff. And while I won't talk a ton about that today, because so much of our email was devoted to it on Thursday or Friday, I do just want to flag that again, that has shifted, that has changed. And so for those of you who have security, facilities, tech, business office that are on campus, it is absolutely a good idea now to have them wearing masks, to at least make sure that those are available to them. And then to be, you can now enforce it depending on what city or county or state you're in. It may actually be law that people are wearing those masks. And so consider that based on where you are, consider that, and of course, always stay compliant with your local sort of law or policy. But as a nation, generally speaking, we have sort of shifted to, yes, we should be wearing masks. The last piece on this sort of now category, this came in, I think Annie asked this question over the weekend, is this idea that as a community, we are exhausted. There's just no way around it. And so at the leadership level, I think we're really good about talking about self-care. And that's an important distinction. I don't think that we're really good about doing self-care or giving ourselves the time and space that we ought to. But we are really good about at least talking about it amongst ourselves. I want to sort of encourage each of you to push a step past that. Actually, really, I want to push 2 steps past that. So the first step is to actually lean in and to give ourselves the time and the space and the self-care that we need. And then the second step is to offer that for our communities as well. The question specifically was something to the effect of, we're exhausted, our community's exhausted, what do we do? And so I can't give you a specific activity or a specific book or specific sort of exercise that you can do as a full community, but I can say, let's start the conversation. Let's talk to people about what they need. And then let's make sure that we've given ourselves the self-care that we need so that we can really listen as wholeheartedly as possible and then start to provide that support, whatever it might be. And it might be a day off. It might be a solution for fundraising or financing. It might be a solution for time so that parents can just get work done. I mean, there's so many different and sometimes competing needs that are out there. Each community is so different when it comes to this, but what are those things that our community most needs? And then how do we sort of arrange and align those resources to be of support to them? I think, for those of you in California, anytime we experience wildfires, which is often, we talk about symbols. And so whether it's a specific piece of art or a specific song or in some cases it's a specific event that took place at some point during the year, what are the ways that we can recreate those symbols, that we can recreate some of the hope and the energy and the enthusiasm that goes into being us? And if those are things that are tangible, how could we recreate them virtually? If those are things that are as simple as a song, and I don't want to undervalue a song, but if it's something like that we might actually be able to recreate digitally, could we do that? Should we do that? Would that be valuable to our community? Would it help us sort of rebuild some of the hope and the excitement that we're looking for? And then last but not least, we've been talking a little bit about hope in the last couple of weeks, and I think we've been talking about it in the sense that there is collective hope. We're looking forward to something that's exciting and coming in our future. One thing that I've heard come up a couple times that I want to just encourage you to think about, and again, this may be applicable for your community or it may not, that's totally okay. But a lot of folks have been talking about what are the things that we're going to take with us into our new normal, and what are those things that we are intentionally going to leave behind. There's a great article on LinkedIn that I'll share in our resources. I didn't get it into the slide deck because I just saw it a few minutes ago. But it talked specifically about kind of how the world might want us to take or to bring certain things into this new normal, but we may choose not to. What I would say is this has created a moment of punctuation, whether we're however we want to look at it, there is absolutely a moment of punctuation. And so what are those things that we want to bring with us? What are those things that we want to leave behind? And is it worth having a conversation within our community about what we choose to bring with us and what we choose to leave behind? And does that help restore some control? Does that help restore some agency in our community? Is that something that would be of value for our community? And of course, you'll be the best person to answer that, but I wanted to offer that as one potential strategy as we continue trying to figure out what does come next and where we're headed from here. I'm going to jump to the next slide, but I'm also going to jump into the questions. I'm going to take a quick glance through these and then we'll keep going. Oh, David, that's a great question. So yes, the question is, if maintenance or security is on site and one of them tests positive, does the whole team need to go under quarantine? Do we need heavy sanitization, etc.? And the answer is probably. So to an extent, it depends on when, and it also, to another extent, it does depend on where. And what I mean by that is, assuming that the CDC and the Department of Public Health in your area have the capacity to do contact tracing right now, which some do and some don't. So if they do, then they will order that the entire team, anybody who came into contact with them, and generally they consider contact to be more than 10 minutes in any specific space. Certainly if people are working together on a campus, that would be considered probably contact, unless there was reason to think that they were so far apart or so independent that they couldn't have transmitted the virus. But they'll typically require that anybody who fell into that category of having had contact would need to be quarantined. And so that's the logic behind that staggered shift setup, where that A team, B team, C team, D team. And again, I would encourage you to call it anything but that, because as it turns out, nobody wants to be a part of the B or C team. But it does at least give us some extra resilience and some extra capacity in the event that we do have somebody that tests positive. Let's see, Josh. Great. So Josh, we will absolutely talk a little bit about that. The question is, what does social distancing look like, and how do we lean into some of the preventative measures that we'll need once we reopen, whether it's over summer or in the fall? So we'll jump into that here in just a moment. And again, today we're going to talk about imperfect scenarios, and we're kind of going to talk with imperfect data or even thoughts about what that might look like, but we'll at least give you a framework to start to work towards, some questions that we might be able to answer, or at least begin to ask. And our hope is that that'll start to inch communities forward individually. And then of course, we'll start to see some really great ideas come together, and then we'll share those out. So thanks for that. Oh, Doug, this is a good question. Yeah, okay, so Doug, Doug has a specific document that you've created that is sort of, it sounds like a workflow. So if this, then that, for coronavirus exposures, for symptoms, for infections, and who's reporting when and how, if you haven't yet been in touch with your doctor, et cetera, et cetera. I don't know that there's a good central guideline for that, but if you wanted to share your document with us, I'm happy to take a look, at least to give you some initial feedback. And then potentially to go a little bit further than that, if it makes sense, we'd be happy to share it with others. A couple of you have shared documents with us, one of which we'll be sharing out in our email later today. Thank you to Mike. I think you're on the call. And there are 7 mics. Oh, I don't think you are, actually. So Mike from one of our schools shared a document that we'll share out this afternoon that has to do with some of this social distancing and how do we do that once we come back. So we'll certainly share resources like that with everybody once as we receive them. One quick flag about that, we'll do a quick proof. We'll always flag anything that doesn't look right for you and for others, but then we'll also scrub your school's name unless you would like for your school's name to be included. We'll scrub your school's name so that you don't have to worry about that in the event that that you don't want to. Ooh, Jeff, that's a great question. Can we require employees to wear masks if they don't want to? I'm going to not answer that question, and I'll tell you, I'm going to kind of walk through a long story of why not. But first, I would say this: if you're in a city, a county, or a state that has created a mandate for wearing masks, then you, as an organization, don't necessarily have to be the enforcers. Instead, you can say the city has required it, and so you know that is our policy for anybody who comes to campus. And of course, if you do that, the intent would be to make sure that you are fully universal about that policy and that you're not providing any flexibility. What that might mean, and this can be uncomfortable for some, is if an employee says they don't want to wear a mask, even if it's your head of school or your executive director or your boss, then you now have to enforce that, or at least remind them that the county policy says they must, and therefore they can't come to school unless they are. So as far as whether or not it directly interferes with employment law or ADA issues or some of those other challenges, those are a step outside of our scope. And so I'd invite you to check in, and I'll see if Liebert Cassidy or any of the law firms have good resources on this, because I imagine they may, and if not, that might be something they could put together. So I will flag it for them. I don't know well, I do know that we don't know enough about those areas to speak directly to those. What I can say is that if somebody's on campus and they're not wearing a mask and the public health department becomes aware of it, that runs some potential risk, especially if our city or state or county has created a specific policy that says that people must, or a specific law that says people must. I know in some cities, people are talking about citations from the police and things like that. I don't know that that's happened yet, but I do know that it's certainly been a conversation and that some are trying to figure out how to navigate forward. Again, recognizing some real challenge there. All right, thanks, Alan. All right, so I'm going to jump back in here. And again, please keep throwing your questions in. I want to make sure we get to those questions that apply to the highest number of people before the end of our time together. And then again, we'll keep going as needed. I've left this slide on the screen for a little while intentionally to sort of give you a chance, A, to screenshot it if you'd like to, and B, to start to sort of think through what it might mean for you. Brene Brown, who's a social worker and researcher and just all around sort of incredible leader, uses this formula, this goal plus pathway plus agency equals hope. And so what we've tried to do here is sort of break it down to this particular situation that we're facing and just sort of recognize what some of these ingredients look like. Obviously, our goal is to resume in-person education when it's safe. Our pathway to do that, this is actually from us to you. So our commitment is you keep showing up and we'll keep trying to figure out the road ahead and trying to make sure that you have a solid set of guidance to follow. But I would offer that for you to your community, that actually might be true as well. And so possibly some additional thought to go into that. Agency, I think, you know, we are finding ourselves stronger for coming together with others virtually, in writing, in emails, whatever it might be. And so I want to just challenge you both to keep doing that yourselves, and then again to keep offering that resource to your communities. And I think we're all looking forward to this idea that we will have a chance to build this new normal. And I keep kind of leaning on the term choice here, because right now we're in a moment where so much of what's troubling us is this lack of control. And I think really leaning into what choices we can offer people gives people back a sense of control, gives people back a sense of agency. And really, as small as those choices might be, and maybe inconsequential in and of themselves, the power of choice is real, and the power that comes from getting to choose is meaningful, and may be enough to help sort of start some momentum up in different communities. So again, I want to offer that as a potential strategy for each of you. We'll come back to that a little bit later as well. So that leads us to our later. And I want to just offer, I know a few folks have joined since the start of the call, and so I want to just offer one last disclaimer here. This is a set of scenarios that we've put together that are completely imperfect, and in fact, the only thing we know for certain is that these will probably not, as they stand, be the scenarios that we embrace in the future. But what we did want to do is to start to ask some questions, or really start to give you some questions to ask. And a lot of this is built based on some feedback that we've gotten from a few of our schools. Some of this is based on feedback that we're starting to feel like we can put into a crystal ball based on what we're seeing from data from other countries, from our own country, et cetera. But the goal, again, is to give you some questions to ask. And so I'll dig into that. What I'd encourage each of you to do is to start to think about scenario one. Could we reopen for the summer, or maybe even for the fall, with social distancing intact? And if you end the question there, I think that's potentially a really good idea. What we've done is we've taken it a step further and offered a couple of solutions here that may help you think about and may help you wrestle with some of the work that might need to go into creating this scenario or making the scenarios practical for you. And again, these are not necessarily good solutions, but they're solutions, or at least questions. So the first is, could we reopen with social distancing and have an extended schedule? So if our class sizes are already relatively small, if we're an independent school and our class sizes are 12 to 20, is there a world in which we could develop a schedule that would allow us to shrink our class sizes even further, so that each class or each room only had enough students in the room that they could still be social distanced in that space? And so that's a loaded question by all measures. But is it possible that we could actually set up our rooms, set up our spaces, and actually kind of coordinate that with our schedule so that we had just enough students in that space that they could still be social distanced, that teachers could still be social distanced, that all of that could still work? And so I'm asking that question, or challenging you to ask that question of yourselves and of your community. And the answer might be no. And if the answer is no, great, that's progress, because we've made the decision that we need to then move on to scenario 2. If the answer is maybe, then let's keep working through it. Let's keep asking some additional questions. I would offer that I think as a whole, it would be easier to do this with older students and with bigger campuses. So for those of you that are in either rural areas, or if you're in spaces or campuses where you've got tons and tons of square footage, then you probably have an easier time doing this. And certainly if you have older students, they follow directions better theoretically. And so again, probably easier to do. It's not to say that this is always going to work if you have a big campus and older kids, but I would suggest this is probably easier there than it would be with smaller campuses or smaller kids. Another scenario that we've heard, and this is an interesting one that actually came from one of our schools, who said, look, we have some students who are just not getting served through digital education. They're just not, it's just not working for them. So what can we do? And they said, could we actually reopen with those students who are being served best through digital education, continuing to be served by digital education? And could we reopen our campus for those who are not being served well for that engagement, or through that form of engagement right now? And that was an interesting question. And so we haven't certainly adopted anything here with them, but we've started to explore this idea that maybe those students, in their case it was K through 2, who were least engaged or least positively impacted by the distance learning model that they had set up, is it possible that that group of students could actually come back to campus? Again, because it's a smaller group and we still have the whole campus, could we set up spaces in a way that allowed them to be relatively spaced out and to have social distancing intact? And then could we keep doing the digital education for those students who were being served well by it? And then, of course, the next step, or the next challenge there is it possible that we could manage some kind of hybrid for a period of time, whether it's a couple days or a couple weeks or maybe even a couple months, where some students were actually served in person and other students were served digitally? And so I want to offer that scenario 2 as another just question to ask, and another, is this something that's practical? Is this something that's conceivable? And if the answer is yes, then keep going, right? And keep asking those questions and keep working through it. If the answer is no, there's no way, that's okay too. And then we just need to go to scenario 3. And admittedly, we have not crafted scenario 3 for you yet. And so it may be that we're just in hold. And our aim is to keep sort of listening to schools and keep trying to pull these questions and share them with you. And so we'll do that either on Thursday or next week's call. But it's perfectly reasonable to say scenario 1 won't work for us, scenario 2 won't work for us. And so we'll keep working to try to come up with some different ones. I'm going to jump into the questions here for a second, because I think I'm starting to see some people who are asking questions that came to my mind, or would come to my mind at least. The first, okay, so let me offer. This all assumes that we are cleared to return to school by either our governor or our mayor, or somebody in government. So that's a really important flag. Thank you for that. In order for us to begin to explore these scenarios, or at least in order for us to execute on these scenarios, we would absolutely have to have the clearance to resume school. And the clearance would, the assumption here is that the clearance would be given assuming we could continue to manage social distancing. So this is not a rogue, resume school tomorrow plan by any means. This is a if we get clearance to resume school, but that clearance comes with a set of expectations that we have to live up to, these are a couple ways for us to do that. And the reason that we're starting to think in this direction is because there's been some conversation around groups being able to come back together that can manage social distancing, and specifically a little bit of conversation around workplaces being able to be reopened that could manage social distancing, some conversation around schools being reopened that could manage social distancing. But again, all of that, A, is not true yet. We've not gotten the authority to do that yet. B, once we do get that, it will likely take a couple weeks for everybody to really figure out what that's going to look and feel like. And C, not all communities will be able to do that, and that's okay too. If you're a community that simply can't do that, then we would want to have that conversation with you, and that really becomes a communication challenge and a set of decisions that you need to make independently that way too. So again, not to say that this would be applicable to everyone, also not to say this is applicable now, because it's absolutely not, but potentially could be a scenario that's applicable in the future for some of us. Thank you for that, Alan. All right, so Don, good question. Thanks, Joel. So Don's question was, what about taking temperatures of campers and staff daily? And I'll offer a couple thoughts here. The first is there are some, I'm gonna sort of break this down into now, next, and later, actually. So now there are some organizations who have chosen to take temperatures for all staff who are coming onto campus at all. And so if you think of that group of four kind of audiences I mentioned earlier, tech, security, facilities, and somebody from the business office or a group from the business office, there are some who've actually required that all of those people who are coming onto campus are going to be screened, and we're going to be taking temperatures. What I would offer is, we shared last week, I'm super grateful to Debbie who gave us a framework for this, but an assessment. And so it's a little bit more robust than just a temperature screening. And it asks things like, do you have an exposure? As in, have you been exposed to somebody who may have tested positive for coronavirus? Have you coughed or had a cough in the last week? And it asks a few other questions like that. And then it sort of rounds that assessment out with a temperature screening. And I think if you're going to do temperature screening now or later, it's really, really valuable to do that full assessment as well. And when I call it a full assessment, I think it sounds a little scary. So it's like 5 questions. It's not a significant workload or a significant lift, but it does allow us a little bit more perspective into what's going on for that person. And so I think, again, if you're going to choose to do it now or later, that's a good idea. The second piece I would offer is that doing a temperature screen is sort of like what we're looking at now. It's sort of imperfect data. And the reason for that is it's really easy to manipulate a temperature. If I take Tylenol in the morning, I can reduce my temperature back down to within normal limits. If I am in a colder part of the country, or I'm in LA and it's 62 degrees, I can turn on my heater and my skin, my body temperature will be increased for a period of time after I get out of the vehicle. And so because of that, it's not a perfect science, it's not a perfect method. And again, I realize we're living in imperfects here. So I'm not ruling it out because of that, but because of that, we're not quite sure how the departments of public health are going to embrace or not embrace temperature screening as part of a return to education or return to work plan. So it's totally possible that the public health departments will get behind that and they'll say it's a great idea. It's also possible that as we get more data, as we learn more about temperature screenings and whether or not it really would kind of screen out anybody who might be contagious, that we might learn that it's not as valuable of a tool as we think it is currently. So because of that, I would say it's definitely possible. And in fact, if for those who are thinking that that might be part of their strategy, one of the things that you can do now is order a few infrared thermometers. It's best if we can use an infrared thermometer because we can keep a little bit more distance from people. We don't have to worry about cleaning. Disposable thermometers, can be sometimes unreliable, sometimes just challenging to keep up with the volume. So an infrared thermometer gives us kind of the most sustainable approach to doing this. And you may choose to order 3 to 5 of those now, or half a dozen of them now, depending on how big your community is. Again, if we're doing temperature screening and we're doing that short assessment, that also means we've got some staff that are engaged to do that, and it means there's a little bit of process and protocol to be built out. But it's very much a scenario that we could see happening. Again, because of those questions or some of that gray area that's created by people's own compliance, it's hard to think that it would be a perfect solution, but it might be one of a few different strategies that you chose to implement. So that's a really good question. Thanks, Don. I realize I didn't fully answer it. So the answer is yes, it certainly could happen. You certainly could choose to do that. Yeah, Jeff, that's a good point. So even how to tackle that. So there are a handful of folks who have a specific population, whether it's a special needs population or a specific grade or a teacher who has been ill or a faculty member maybe who has passed away. There are all kinds of groups of students who might be exceptionally better served by coming together in whatever form was necessary in order to make it safe for them to do so. And so for those folks, and again, it could be any number of different reasons, that idea of creating an on-campus or maybe just in person, maybe it doesn't have to be on campus, but some sort of an in-person sort of session, again, whether it's short-term or long-term, just a day, or maybe it's for a few weeks, or maybe it's the plan for the year. All of that could be really, really valuable for some specific subset of our students, maybe even about our staff and faculty too. So thank you for naming that. Certainly, as we think about these different scenarios, they don't necessarily need to be for everybody, and we can absolutely choose to prioritize. This is a great question. So is it legal to take an employee's temperature? It's medically invasive, at least potentially. Does it add legal issues? We need to be careful, is the bottom line. And the answer is A, yes, we need to be careful. B, regardless of what I say in just a moment, you should absolutely confirm this with your own counsel. This may be different by state. It may be different by type of school, and may be different by any number of other factors too. So I cannot stress strongly enough to check in with your own counsel on this. We did do a call at the beginning of this response. It was mid-March, where the legal counsel that was with us on the call said, there's really no reason that we couldn't do a temperature screening. And specifically what they talked about was it had to be universal. So it couldn't be that we just do temperature screening for one student or one age group or one population. We had to really be thoughtful and mindful about preventing the perception of discrimination, and obviously also preventing discrimination. That essentially we had to do, so long as we did it consistently and in a way that was consistent with whatever policy or protocol type language we had put together, that it could be done. Again, it doesn't necessarily mean that it's the best solution, but from at that time at least, it was believed that it was an acceptable solution. So again, if you choose to start heading in that direction, I can't underscore enough, you should check in with your own counsel, make sure that you have whatever documentation they want to see. And I would also offer that there are some wrinkles with this. Many of you know we have an event safety team, and so we have over 1,000 EMTs around the country that do medical support for events that happen throughout the year. We were contacted by well, actually, we've now been contacted by a few organizations to do temperature screening for them in their critical infrastructure sites, and so some government sites, some tech sites, and like redundancy sites, things like that. And when we started working out the details, it became clear that their council had advised them that they couldn't use their own security or medical staff. They had to contract out. And so, I still don't fully understand some of the why behind that, but I would encourage you to make sure that you're really clear about what the plan is with your legal team, and make sure that you build for the most protected plan when it comes to this, because there's no question that this is going to be a little bit muggy for a little while. Oh, Jack, thank you for that. So we're getting a little bit in the temperature weeds here, and we'll zoom back out here in just a second. I have not quoted or vetted this link, but Jack just shared an article I'm going to drop in the chat panel. Again, I have not vetted this yet, but it suggests, or at least Jack is sharing that the Department of Labor has dropped the requirement that employers can't do temperature screening. And I would also flag that Melanie just shared that they were given counsel that they could not do temperature screening for employees. So again, regardless of what might be best from a health and safety perspective, or sort of embracing maybe even what might be best from a health and safety perspective, it's critical that you check in with your own counsel and that you get the right feedback on whether or not you can do it, and if so, what the parameters of that solution need to look like. I'm going to jump back into the slides for just a second to flag that there's a short or a visual on the screen that just sort of gives you the idea of what we might be trying to do. Social distancing theoretically, well, currently means that we want to keep a 6-foot distance between ourselves and anybody around us. And so this classroom that I think has 24 seats initially suddenly has 9 seats in it. And you can imagine, that this may or may not be appropriate based on the number of desks that you currently have in a space and how big that space is. Furniture may represent a challenge in and of itself. A quick flag that I'm getting some feedback that link doesn't work, so we'll take a quick look at it in just a minute and see if we can get that link corrected. But some buildings, some spaces, theaters, et cetera, just simply don't have spaces that are flexible enough to accommodate social distancing and similar sort of changes. And so this is not to say, again, that this is going to be something that works universally. It's not to say that it's something that has to work for you, but wanted to offer that there are a bunch of different designs that you might consider for this. And really the core goal, the one thing that would be that you'd be trying to work toward, is to figure out how to keep that distance. Some folks have asked questions around cleaning, and I've said things like, if we do decide to go back to something sort of like this scenario on the right, everybody's using the bathroom throughout the day, or everybody's using the railings or the elevators. And I will share that although CDC has not published this yet, we expect that CDC in the next couple of weeks will publish a set of guidelines for how to keep schools clean. I don't know what those are going to look like quite yet. I would guess that there's probably a couple layers to it. I imagine the first layer will be frequency of cleaning. So how often do we want to wipe down those high touch surfaces like railings, like elevator buttons, like light switches? And then if there is any specific guidance that they choose to give on what treatments to use, what cleaning solutions to use, then obviously, A, they'll share that, but B, we'll make sure that you have access to it through us as well. And I imagine that one of the things that they'll talk about is that throughout the day that restrooms, railings, elevator buttons, all those are types of things that would need to be cleaned significantly more frequently than we're accustomed to now. So an exercise I offered to a group that we talked with last week was maybe start right now with thinking about, what if we had to clean those things 4 times a day? And again, that's not because that's what their recommendation is going to be, or because I even think that's close, but really to say, let's just start somewhere. And so if we did need to clean those things 4 times a day, what would that look like? What would it look like from a staffing perspective? What would it look like from a solutions perspective, and like just having enough supplies on hand to keep up with that demand? What would it look like from a vendor perspective? Is this a group that we would maybe have otherwise used at night, but now they need to come in during the day. Can they do that? Are they set up to do that? Are they interested in doing that? And then of course, what does it look like from a budget perspective? So would offer that you'd want to consider each of those things as you sort of work through this idea that we might need to clean 4 times a day. And again, I use that 4 times pretty arbitrarily, but because it's more than we're doing right now for the most part, and it's a starting point. And so hopefully as that guidance comes out, we'll be able to adopt it and sort of adjust to whatever it might look like and be. All right, I'm seeing a bunch of links. Thank you all. All right, so Jack, thanks. I'm gonna drop this, just jumping back into the chat here. And again, I have not even opened the link yet, so apologize if it's not spot on. We'll take a look after the call and make sure that we share it out with everybody. Along with, I'm seeing a ton of other links that have come in, so we'll share those with you. We'll do a quick vet and make sure that they're in the right direction, and we'll share them with you coming out of the call. So in today's conversation, we promised a little bit of a look ahead, and I hope that these couple of scenarios have been valuable to everybody. Again, these are imperfect scenarios, they're imperfect answers based on some of the feedback. Some of you are thinking this is helpful, others of you are concerned about kind of how practical some of this is, and I want to be so clear that whatever is going through your mind right now is probably right for your community. And so by no means are these the end all be all scenarios. We're going to keep building on these. And our hope is that as we keep going, that 1 or 2 of these make sense to you and feel like they would fit your community and match your needs. And hopefully that they'll be helpful. And maybe even the fact that you've seen or experienced some of these other scenarios will jog a different idea in your own minds. And so please feel free to share new scenarios that you come up with or new ideas that you come up with. Again, a handful of you, I think at least 3 at this point, have shared completely conflicting versions of what you might return to school or how you might return to school. And the fact that they're conflicting is awesome because it will give more of these scenarios, not just to us to explore and experiment with, but to others on this call, others that are part of this community. And so I'm grateful for that. We will make sure that we share those out with you this week. Again, I'm not sure whether it'll be today or Thursday. We just need to vet them a little bit further before we distribute. And then of course, eliminate school names and things like that. So a little bit of work to do, but we'll do that and we'll get them out to you. This is not the end for everyone, but this is the end for those that need to hop off at 10 o'clock. And so I want to just wrap up, and then I'm going to dig back into some of those specific questions that are still there. First and foremost, thank you. These conversations are conversations that I have found myself, and I hope you have found yourself looking forward to. And so thank you for spending this time with us. For those that weren't on at the beginning of the call, I know about 40% of folks tend to join at about the 15-minute mark. So I want to just do a quick recap of this. We are committed to sending you an email on Thursday or Friday with updates from the current week and some strategies for what to think about in the following week. We're also going to give a little bit of a sneak preview as to what we're going to talk about in the call on Mondays so that you can decide who from your team is best suited to join that call. We'll hold these calls every Monday morning at 9 a.m. Pacific, and we're going to keep doing this. We've extended the GoToWebinar registration settings, whatever that tool is in GoToWebinar. So we've extended them through, at this point, the end of May. I anticipate we'll probably extend them a little bit further, but we'll certainly be with you until the end of May. One quick note about that, if you've registered for one, you're automatically registered for all of them. So you're welcome to keep registering. It doesn't impact anything negatively. And if you're ever not sure, always better to err on the side of caution and go ahead and register. But if you've registered for one, you will be permanently guaranteed a spot in this call. And then last but not least, for ways to check in, you can follow me on Twitter. Again, emergency managers use Twitter to stay up to date because it's so easy to get a huge amount of information all at once. And so I would challenge you to try to do that, whether it's through Twitter or through any other mechanism. Maybe it's asking somebody, maybe it's a homework assignment for a student of yours, a child of yours. but I'd encourage you to find, sort of batch consumption and avoid kind of the frequent updates that can sometimes feel really, really hard to manage and really, really hard to get back engaged from. And then, of course, beyond that, you're always welcome to send us an email at support@joffeeemergencyservices.com. So to everybody on the call, thank you. I hope that we see you again next Monday. And if nothing else, you'll hear from us again later today with a copy of the recording and the slide deck, and then on Thursday with some updates for next week. And I hope you have a safe and healthy week. And as always, we're here for you if you have any questions at all. So thank you again and have a great week. For those who'd like to stick with us, you're more than welcome to do so. I'm going to move through a couple of these more specific questions starting now. Go back up to the top because I missed a couple. Oh, Betsy. Let's see, are you with us? I think, Betsy, I don't think you're with us at this point, but Betsy's question was, what does comfortably uncomfortable mean? And I just wanted to go back to that. So we talked about this idea of sort of being comfortably uncomfortable. And what I am trying to get at when we talk about that is we're in this period of time, a few more weeks at least, where we're dealing with answers that are imperfect. We're dealing with kind of a challenging and uncomfortable amount of volume of questions from parents and concerns from parents and students and faculty. There's just no question that we're having that it's going to be tough to keep kind of leading through these next few weeks. And so the idea of being comfortably uncomfortable was sort of to say, for those that can lean into it and sort of get comfortable with some of the discomfort that we're experiencing, we want to encourage you to do that. Of course, not everybody can for any number of reasons. And so that's okay too. In fact, it's maybe even more powerful to recognize that and to make other arrangements. But want to encourage folks who are able to lean into it a little bit to do just that. Ooh, Doug, this is a good question. So Doug's question is around, well, Doug, I'm going to take your question a little bit of a different direction. Doug's question is around early childhood parents who are lacking childcare right now. A handful of states or counties have actually required that schools make some form of childcare available. So for those of you that are in that boat, I think you probably already have strategies for this because that's been in place for a few weeks. Having said that, if childcare is the ultimate benefit for a family, which is potentially true at the early childhood level, it's also potentially true at any other age for what it's worth. This is really, really exceptionally difficult. And so one strategy I've seen that a small handful of schools have tried, and I haven't actually heard back on whether or not this works, but folks were excited about it. What they chose to do was they started these Zoom rooms that were more like tutoring sessions. So it was, 15 kids being, in a room, kind of if you could imagine like a study hall type environment where there is a teacher who's present, but there's not really a lot of direct engagement that's taking place. And the idea behind that was that then there could be at least some level of supervision for students. And again, this probably doesn't work so well for early childhood, but for older students, this may be one strategy, maybe higher elementary school to middle school, could be one strategy to co-supervise potentially with parents who are home. There are some obvious consequences or challenges with that, not the least of which is, where do we draw the line between supervision and education? What is the escalation protocol if something takes place, or if there's disciplinary action that needs to take place? So I won't even begin to explore those. Those are areas that each school would have to kind of troubleshoot independently. And I don't yet have a document that's come back from one of the schools who's chosen to do this that offers kind of best practice or at least what their experience looked and felt like. But as we get that, I will share that with you. It's one strategy. And again, it's not to say it's a good one, but it's certainly one strategy that we've seen others use. Let's see, I'm just looking through a couple more questions. If contact tracing doesn't seem, okay, so great question, Annie. So it doesn't seem feasible to do contact tracing with a school. There are so many people, and everybody essentially comes into contact with everybody else. What I'd offer is one of the strategies that the CDC, public health departments, kind of the global perspective to this is they're looking to figure out how to most quickly identify somebody who tests positive, and then how to manage that person on a kind of go forward basis. And so how to get them to quarantine, how to get them to a position where they can't infect other people. And so one of the things they're looking for is what are the earliest signs of the virus having infected somebody. And we've seen these articles about whether it's loss of taste and smell, or whether it's temperature, or whether it's upset bellies, and all these other different perspectives. And their hope, their biggest hope, I think, is to identify what is that very first sign that's consistent across everybody who's diagnosed. And once that's identified and we can really get ahead of that person infecting more people, I think that's one of the signs that they'll feel really comfortable with the idea of contact tracing, because they could do it maybe a day or 2 days or 3 days before we're able to currently do it as it currently stands. So that's a long way of saying, yes, I think as we're looking at this scenario now, and as we're looking at the data that we do have available to us right now, contact tracing in a school would be really, really tough. There's just so much movement. There may be things that we could do, and I'll share. One of the ideas that I just saw a plan this morning. A school was talking about trying to limit busing, so kids were actually going to be dropped off instead of taking the bus, because that was one way to limit the number of people who were together. There was an idea in the same document about limiting lunch and having lunch served in a classroom as opposed to in a bigger, kind of cafeteria servery type environment. Limiting recess for students where that was practical. So certainly there are things we can do to mitigate some of that movement and to help make sure that it stays as safe as it can be. But it also doesn't necessarily work based on the information that we have. We probably need a little bit more information, a little bit earlier signs and indicators before we can really lean in and say, yes, that's going to work for us. But how do you social distance with children of any age? Great question. So yeah, the reality is different age kids, differently cultured schools are all going to have a different reaction to and a different response to this idea of social distancing on campus. It's really tough to say to 2-year-olds that they have to social distance, and frankly, it's probably maybe better understood, but equally tough to say that to any student. So as a matter of, or as we kind of lean into this and think through this, we'll have to be thinking about bathrooms, hallways, common spaces, outdoor areas, but we'll also have to be thinking about what expectations we can set and what expectations we can ultimately enforce that would keep everybody safe. And I think we have to be equipped for some form of transition to something similar to what we're handling now. So I said that terribly. What I mean by that is, I think even if we're given the authority and we work to develop a plan so that we can come back to school with social distancing intact, I think it would be important for us to have the backup plan of how do we actually resume distance learning or online education or digital education in some form in the event that we're not successful at social distancing on campus, or in the event that there's an outbreak at our school, near our school, in our community, somewhere else in our country. And in fact, I'd go so far as to say, I think the most successful tech teams as soon as we go back to online, or excuse me, to on-campus education, I think the most successful tech teams will actually go back to their drawing boards and say, how can we do that better? Because I think it's, whether it's in the fall or in the winter or 3 years from now, I think it's likely that we will find ourselves in a situation where we need to conduct digital education again, in some way, shape, or form. And so, again, just to be completely clear, I don't necessarily mean that it'll be pandemic driven, but I think in California it might be for wildfires. I think on the East Coast, really, I always pick on Florida for this, but on the East Coast, I think it's plenty likely that it could be a hurricane or a severe weather incident. If we have tornado watches in the Midwest, I mean, there are so many different reasons that now that we have this tool in our tool belt, that we could leverage it and we could really be stronger for it. I think the best tech teams and probably the most forward-thinking groups will come back and will say, how can we do that even better in the event that we need to in the future? Yeah, Dimitri, there are a lot of these young students. It's going to be tough to keep kids apart, and maybe not practical. So I don't want to undermine the challenge that you'd be embracing there. As I'm working through some of these questions, there's some really good ones. All right, a couple of these I'm going to respond to one-on-one. Akila, in particular, yours, I think is a great question. It's a little bit out of our scope, but it is one that I think I know who to connect you with, so I'm going to try to do that. David, oh, thank you for the CDC resources. Don, a lot of stuff around the temperatures. Thank you for all of that. Kelly, that's a good question. I think, so Kelly's question is what liability does a school have if they were to open for summer camp or for school and staff gets sick? Should we be sharing out risk from an HR perspective in some way when we have people return? What about folks that are over 65 or in whatever demographic might be impacted or believed to be impacted most by this virus? That's a really good question. I think I would offer a couple of thoughts. The first is, as we move forward toward reopening, there's going to be guidance offered by the CDC, by the public health departments, by a variety of other agencies. And one of our challenges, and this is really, I think, the role that Joffe plays most appropriately, is to kind of translate that into the operational decisions that we're making at individual schools. And so assuming that we can be compliant with those, I think we have some protection, we have some some shared responsibility at the very least, or shared culpability at the very least for what we do. I also unfortunately think that generally those guidelines tend to be on the minimal end, and so we want to be extra compassionate, extra cautious, extra caring as schools. And sometimes that creates some really unique issues. This is a long way of saying, until they put out that guidance and that criteria, I'm a little hesitant to get too far into the questions around who we might intentionally exclude or include, and if we made those types of decisions, how we might manage through some of that. But I do think it's the right question to be asking, and I think we're probably a little bit early to answer it, but I hope that we can answer it at least a couple of weeks before we resume in-person education, whether that's camp or school or anything else. So I really like the question. Thank you. And I guess the other thing I would offer is we do have a sort of running parking lot going for questions like this that we're maybe just not ready to answer yet. So I'm going to add that to that list of questions, and as we get a little bit closer, hopefully be able to answer that. Oh, this is interesting. Jacob is leaning towards partnering with families to screen their children instead of having the school do it. And also asking then the families to answer those questions for the school each day. That's a really interesting idea, and certainly reduces some of the bottleneck and other challenges that you might deal with if you tried to handle the screening on campus or at drop-off. Those are bottleneck times bottlenecked times as it is. So certainly, creates a little bit of ease at a time that could otherwise be really challenging. I think that the compliance issues are still there. You could probably make a case that they're a little high, the risk for non-compliance is a little bit higher if families are self-screening. But there's also, I would imagine that you can make the argument that the responsibility or culpability for getting a bad read on a thermometer would be a little bit less. So it's a really interesting idea. We'll have to explore that a little bit more with you. All right. I think that does it for the questions that it looks like are going to be most applicable to everyone. Again, there are a couple questions that are here that are either hyper personally kind of geared, or maybe even have some additional questions that we need to ask to give you the best answer. So I'm going to follow up with you by email for those of you that asked those questions. A quick reminder that there's no question that's too big, and certainly no question that's too small for us to answer together, especially in these moments after the bulk of the group is gone. But thank you to everyone who's joined us. Thank you to all of you who have stuck with us past the 10 o'clock hour. And really thank you for the leadership that you're providing in your communities on a day-to-day and week-to-week basis. It's so incredible to get to see emails from you and plans from you and sort of where each of you are headed. And so thank you for that, and thank you for allowing us to be a part of this journey with you. Hope you have a great, healthy, and safe week, and we look forward to seeing you again next Monday. Thanks, everyone.